Um, Martin, could you tell us a little bit about yourself first?
Yes, I qualified in clinical psychology a long time ago, and I went to work in the Addiction Research Unit in London under Mike Russell, and that's where I learned how to treat smokers, to do smoking treatment research, and I went on from doing research to doing work on treatment policy and treatment policy implementation, which is what I focus on mainly now.
Martin, tell us, you have been very instrumental in the development of guidelines for Article 14 of the Framework Convention. Could you tell us a little bit about the significance of these guidelines in relationship to smoking cessation in Latin America particularly?
I think the guidelines, the Article 14 guidelines, in effect, are official policy on tobacco dependence treatment for signatories to the FCTC. So I think they are very important because they set the policy framework and they basically outline what each country should be doing, ideally, on tobacco dependence treatment.
How do you see the situation in Latin America in smoking cessation, and what are some of the key challenges?
Latin America is actually very similar to most of the rest of the world in the provision of treatment services at the moment. Provision in general is very, very low, and so the challenges are to improve provision and to get treatment onto the agenda. But I also think it's important to do that in a correct way and in context, and not, for example, to prioritise expensive treatment interventions that are difficult to scale up compared with, for example, broad reach, low cost. And I do think that's an important point, especially because if we treatment experts push a kind of model of treatment which governments and policy makers see as expensive, we're going to damage our own case for increasing cessation provision.